The next side effect that you must learn to avoid is dry eye. So dry eye sounds like a mild side effect, but I've suffered this myself after an eye injury. I was working on some wood once and the bit broke off a router and hit me in the eye. I then had dry eye that I had to treat for about a month, putting drops into my eye, and it was miserable. It really gets in the way of a lot of day-to-day function, and if you do this to your patients, it's certainly not to be dismissed as a mild side effect. But thankfully, it's rare and also easy to avoid. Let's understand what could be causing a dry eye. It starts by understanding the position of the lacrimal gland. If you have a look in this 3D diagram, you can see the position of the lacrimal gland just near the suture between the zygomatic bone and the frontal bone. I think in many people it's probably more superior than this when I've looked on cadavers, but the important point is it is in an area where we do inject. There are two ways you can affect this. You could just be doing a lateral canthal treatment, treating lateral canthal lines with a 4-unit dose here that happens to be a bit close to the eye. But there's another injection I do very frequently, which is treating underneath the eyebrow, where I'm affecting the orbicularis oculi, trying to get a little bit of lateral lift. So how do we avoid these injections causing the complication? The first thing is to think about that orbital rim as one of the boundaries that you always check and leave, if you're treating lateral canthal lines, the 1.5 centimeter margin. And the second principle applies to both areas, whether you're treating underneath the eyebrow or the lateral canthal lines. It's all about depth. As we talked about before, orbicularis oculi, which is the muscle we're trying to treat, is superficial. It's underneath a thin layer of skin, and underneath the muscle is fat. And those layers can be used to defend the tear gland from botulinum toxin. So we're 1.5 centimeters away, or very superficial, shielded by the layers of tissue which defend the eye. So defending the lacrimal gland is ultimately about being out of the tissue plane that could be affected. So if you are superior to it, but shielded by the muscle, a layer of fat, and the orbital septum, you are going to be much less likely to cause a dry eye. If you're injecting lateral canthal lines, you also have the ability to leave a 1.5 centimeter margin, which also makes it much less likely that you'll get anywhere near that structure. The next area to think about, which is more about side effects than really a complication, it's an unwanted effect, is when you overtreat the lower lateral aspect of the eye. This happens when treating lateral canthal lines, so trying to get rid of crow's feet. If you treat a little bit too heavily, you can get relaxation of orbicularis oculi, that then meets the transition point of the zygomaticus major as it pulls up and then causes a little ledge. So the patient will present a new shadow or ledge on their lid that they don't like when they smile. And this means they're not happy, even though you've clearly got rid of all their lines and wrinkles. Now, how do we get rid of this problem? It's really a matter of dose. And if you reduce your dose on the lower aspect of the eyelid, I only use 2 units for nearly all my patients now. You get a great result without causing ledges and without causing some of the next side effect, which I'm going to discuss. So the next side effect, as described by Julie Bass-Kaplan, is looking a bit like a psycho. Now, what's going on with this?
I had Botox under my eyes here and didn't realize that my time was over for Botox under my eyes, right? So every time I smiled like a psychopath. Like I was smiling like this the whole time, right?
It's all down to descent of the lower lid. If your lower lid descends down, you look a little bit too wide-eyed, and as Julie describes, this makes you look a little bit scary in certain instances. And you will see this on many injectors, and it comes from over-treating underneath the eye. As you get older and you lose collagen and elastin, if you're treating an area that is basically held together by the muscle, and you relax that muscle, you will get descent of the lower lid. And it's, even though the lines and wrinkles may be gone, it just doesn't look that attractive. So this is quite a common side effect that's easily avoided, essentially by patient selection. So make sure you choose patients who have a good snap test, clearly have plenty of collagen and elastin, and use low doses, and you shouldn't have this problem. It's also worth consenting your patients into understanding the difference between getting rid of lines and wrinkles and actually looking better, because sometimes you do achieve one outcome, but you don't get the other. Finally, there's a very rare complication, and this actually happens in really old people, even if they've never had botulinum toxin, which is the skin quality deteriorates so much that you actually see the pink of the lower lid. So this is called an ectropion eyelid, and showing pink underneath the eye is a side effect of that tissue that is unable to hold itself in position. But if you add botulinum toxin to someone who's nearly at that point, you can see how that would bring this problem on. So the orbicularis oculi is actually holding the lower eyelid against the lower part of the globe, and as you relax it to try and get rid of a line, it then falls outward. And you end up with a very unattractive but very rare complication. I've never actually seen a patient get this, though I've read about it, and it comes from poor patient selection, and very high doses of botulinum toxin in the lower lid. So to avoid this complication, basically, I do very little treatment underneath the eye. I think it's only suitable for a very small minority of patients. So the reason to do it is not strong in my opinion. I think it sometimes helps certain patients with very crinkly skin, but they're quite young, and you can soften it with a very low dose. But for most patients who have lines under their eyes, they're actually caused by the zygomatic muscles and the cheek elevators, which squeeze the lower eyelid skin during a smile. And so treating orbicularis oculi is only going to have a minimal effect anyway. And sometimes it even makes it worse. So patient selection, and what I'm basically saying is I don't think it's a great treatment anyway. So try not to do it unless you've got a very clear reason why you think it's going to work on your particular patient.